I'm Dr. Stephen B. Marcum. I'm a Marine. I came in to see Dr. Yu, and after 6 laser treatments, I was able to walk upstairs and downstairs without use of a rail. We had videotaped that. I didn't believe it was going to happen. The VA 10 years ago said they needed to replace the knee because of a torn meniscus and arthritis. Most of the Marines I've spoken to are still in pain and suffering even after 3 surgeries. Replacing the knee only lasts several years, and then they have to replace it again. For myself, I'm a pharmacist, a compounding pharmacist. I've been in medicine about 30 years, graduated in '74 from Chicago, the medical school there. Got 3 degrees in medicine, and I believe in alternatives available to people because opioids have the side effects. Acetaminophen can be an overdose, and a lot of our Marines have been turned off of the opioids and turning to heroin and are getting acetaminophen overdoses. So since the treatments of the laser, I was able to cut my dosage in half and use half as much as a dosage regimen that I was on.
So you came in here, looks like last year, April 21st, 15. So that's about 10 months ago. And you had how many laser treatments for your knees and your feet?
6, I believe.
And
plus a freebie, I think.
Okay, and then after 10 months of treatment, how have the knees held up?
The knee is held up really well. I could say it slightly wore off where, if I was to get technical, it excites the outer electrons and heats up the tissue in the knee. Because of that, over time they collapse back in on the subshells, so it does need some more attention. So I go to the injection. The Japanese use honeybee and sting their joints with that for hyaluronidase. Well, now we have that injectable for synovial fluid. It helps flood the cavity and permits some space. I've had the injections 3 times, but I reached the ultimate. When I had the laser treatment, I was able to skip those injections. And they're weeks apart, and the needle's about this long, and it's very painful. So I'm grateful to Dr. Yu for that. I can recommend it to the VA, but they don't cover it for some reason, laser treatments. I don't understand that.
Well, they're finally covering chiropractic, so maybe this is the next step. All right.
All right. I'll agree with that.
All right, Doc, I'm glad the laser worked for you. And then how did your peripheral neuropathy respond to the laser? I remember your stair climbing was better? Or?
I have almost no peripheral neuropathy.
And that's after completing your treatment over 10 months ago.
Yes, I'm still a little bit off balance, but then they've given me new shoes and inserts and things like that to correct my walk, and I didn't know my gait would affect my spinal column, and I'd have had one chiropractic straighten my spine, but they x-rayed me head to toe, and everything on this knee is 1.4 millimeters on the inside and 11 on the outside.
So you still have some space left, huh?
I have some space left. Would let you know, the women, they walk pigeon-toed, so they will tear it on the outer side.
Okay.
Men walk
inside because their knee pronates in too.
Right, and in men, we will disintegrate on the inside. This is a natural occurrence with arthritis.
Yeah.
So I'm expecting this knee to also need treatment in the future as well, but time and money, that's what it's about.
All right, Doc. Well, thanks for your testimonial, and you're going to help a lot of people, get a lot of knee pain and peripheral neuropathy relief with your story. Thank you.
Thank you. God bless.